Good morning and welcome to Eye on New Hampshire. My name is Marga, and we've been focusing for May, the fact that this is Mental Health Awareness Month. And so we've been privileged to talk to a number of different people from different organizations. And today I'm joined by Thomas Grinley, who is part of the State Department of Health and Human Services for New Hampshire. Good morning, Tom.
Good morning.
You have a nice radio voice. Has anybody told you that?
I have been told that.
So if you can come back and visit me another time, we'll get you going in the other industry. But for right now, you've done some great work in the area of mental health. And when I introduce you as from the Department of Health and Human Services, that doesn't even touch on some of the offices that you work with. Can you tell us about your background?
Okay. I'm with the Office of Consumer and Family Affairs, which is part of the Bureau of Mental Health Services. Basically, my job is to amplify the voice of those with mental illness and their families. And one of the things that I find key to doing that is to address mental health stigma.
I think that that's something that is changing and hopefully evolving, but we still have a ways to go. And one of the important points that we've been addressing this month is mental health awareness. It is talked about more than it ever has been. But we still have obstacles that we're trying to overcome with how people are treated if they are dealing with their mental health in a way that's either helpful or not helpful. But just the idea of mental health, it's getting there, but it's not quite there.
Yes, we have a long way to go. A lot of people have misconceptions about mental illness. And part of my job is to try to challenge those misconceptions so that people can learn.
How do you do that with people when they're, if they already have preconceived notions of, if you're mentally ill, well, that's it, you're done. Is that true?
Mm-hmm. No, it's not true. I think a lot of people think that way, and they tend to have these misconceptions that mental illness means that your life is essentially over, and that you can't work, you can't hold a job, you can't have a relationship. All of these misconceptions contribute to the stigma of mental illness. And stigma hurts in so many different ways. One of the things that brings me here is I wrote to the general manager about one of the on-air personalities making a joke about being bipolar.
Mm-hmm.
Now, I know it was intended in humor, but bipolar disorder is a serious mental illness and should never be the punchline of a joke. So that's one of the things that I do. When I hear an inappropriate use of a mental health term, I challenge people on it. And some of the other things that I do is I'm an in our own voice speaker for NAMI, New Hampshire. And I go to public groups and I tell my own story of my mental health challenges. I'm also an instructor for mental health first aid, which not only gives people the tools that they need to help someone in a mental health crisis, but it does a lot to address the stigma of mental health.
And I think for people that don't know what NAMI is, can you explain what that organization does?
NAMI is the National Association for Mental Illness. They have a New Hampshire chapter. And NAMI is a group that I work with very closely, and they're also in the forefront of it, addressing the stigma of mental health.
Now, you have an important point of just because you work for the State Department, there are other service organizations that are focused on mental health, and you really do approach it with a team effort. I'm constantly hearing of the different organizations kind of, multi-level working together.
Yes, we work very closely together.
And what's some of the work that you do, not only in your own job, but with those organizations?
Well, with NAMI, the main thing that I do is I'm part of their In Our Own Voice speaker series. And what we do is we go out to different groups and we talk about our own challenges with mental health. Okay, myself, I have bipolar disorder.
Mm-hmm.
So I go out to local groups. I talk about my struggles, my road to recovery.
Right.
And it gives people a completely different impression of what mental health is all about. They see that, we're not the scary person mumbling on the street corner.
Right. Right. There's so many levels. And I think that's why it's, first of all, the word health is attached to mental health because it's like your physical health. You should go see a doctor once a year if you're not sick just to get a checkup. Mm-hmm. I think people need checkups for their mental health as well.
Absolutely. There is no health without mental health.
Right. And I think that, you just mentioned the difference between someone mumbling on the street or someone that has an inner struggle and doesn't know how to deal with, say, depression or bipolar disorder or PTSD. So many different levels of mental health now that are finally being addressed, being talked about, but there are still people struggling and not sure how to make that next step, how to get help.
hmm And that's also part of mental health stigma. I mean, it's the stigma of mental health that prevents people from seeking the help that they need. It's particularly bad in certain groups that, you know, uh, colored individuals, for example,
Sure.
okay, in the BIPOC community, you just do not talk about mental health challenges. Other groups, mental health challenges, the LGBTQ community,
Right.
okay, mental health challenges are a serious issue. But because of all of the stigma that, those folks are dealing with, it makes it harder for them to seek help.
Do you think that we're going to finally start seeing more kindness, more or less judgment on people, how they choose to dress, what gender they choose to be? It used to be just religious worship and color of your skin, and those things were terrible. And it now feels like there's so many layers that when you say stigma, my mind starts exploding with all the different things that people are dealing with.
But there has been progress. I think lots of different groups, we've seen progress. In my lifetime, I simply can't believe how far we have come. Yet at the same time, I have trouble with how far we still have to go.
And how do we do this? How do we accomplish this? Is it just keep talking? Is it just having people understand that you can go to someone, you can talk to them, even if you don't feel like you have a big problem or it's not that bad, I can deal with it? I think that people, stop themselves from getting the help they need, even when it's something that they just don't consider it a big deal or big enough.
Talking is essential. I mean, we need to make people feel more comfortable about mental health in general, whether it's theirs or someone else's. 1 in 5 people has a mental health challenge.
Really?
So when I do training, I tell people to look to their left, their right, in front of them, and behind them. I say, odds are one of you has a mental illness. And people just need to understand that and understand how much common it is.
What kind of reaction do you get when you say that to people?
Stunned silence in general.
I bet.
And people looking around nervously. It's like,
is it me? Is it the person next to me? Who is it?
Exactly. And those are the types of reactions that I get. But then the follow-up that I get and feedback after the training is that I have really changed people's opinions.
I think the fact that you share your own your own bipolar disorder, and if disorder is the wrong word, I apologize.
No,
but
that's the correct word.
That people are too scared to just say it and say what's wrong with them. I think we need to stop that. We need to stop, you said stigma. We need to stop that. It's almost like name calling. No, it's a name for what you're dealing with now.
Mm-hmm. Yeah. I've struggled with my mental health all my life. The day that I finally shared my story with people, I mark as the first day of my journey to recovery. I finally opened up and told people what I had been dealing with. And I told people things I had never spoken of to anyone, not even my wife. So it was very cathartic for me to finally let it all out. And then I tell my story all the time now, and it does a lot to change people's opinions.
That's funny. This is probably the third time that I've heard that in talking to so many people from mental health and the organizations that we've been privileged to speak to, that the number one thing was the feeling and the healing that comes with saying it, with talking. And it doesn't have to be a family member. As you said, it can be a licensed professional. It can just be a friend to start, to get you to the next step. I'm sure you hear that all the time about the connections and the levels. It takes somebody to get to that point of finally going to talk to somebody, in a service organization or a licensed professional that can help you.
Mm-hmm. When I've spoken to groups in public, I've had people come up to me afterwards and say that they've always suspected someone they knew was struggling with mental health challenges, and they didn't know how to approach it.
Yeah.
So I encourage people to talk about it.
I think people are scared. Do you feel that way, that people are scared to approach someone that they think has a problem because they're afraid they're going to be accused of judging them or hate or anything that's absolutely wrong? But what do you tell people that realize somebody else is struggling but they're not getting the help they need?
I think there's a whole lot of things going on there. I mean, I think one of the reasons people might think that they are judging is because they consider mental illness to be a judgment to begin with.
Mm-hmm.
And they don't understand how common it is and how many people are struggling with it. I think, the stigma plays a huge role there, and, not wanting to talk about it. One of the other things I do is I'm a certified suicide prevention trainer. And one of the hardest things to train people in both QPR, question, persuade, and refer,
Okay.
and mental health first aid is to ask that question. Okay, that is the hardest thing for people to do, to be able to ask that question, particularly if someone is feeling suicidal.
Right.
Okay, people are very frightened about something like that.
Yes. Yes. I just sitting here now, when you said that, I can feel myself tensing up because my first concern would be if I say something to them, they're going to stop talking to me.
Mm-hmm. Yeah, the myth is that if you say something to someone that you're putting the idea in their head, and that's been proven to be a fallacy. I mean, you really, typically someone who is feeling suicidal is very ambivalent about those feelings. So, asking the question and starting that conversation can be the huge difference in that person's life.
It could be as simple as, "Are you okay?"
Absolutely.
I think that that's so important for people to realize, that just showing that you care and that you're interested in them and their well-being is a crucial step.
Absolutely.
I would like to know from you, too, when you're talking to different people, do you change your approach if you're talking to kids, if you're talking to adults? Does it change the way you approach mental health?
And I probably changed the way I approach any group.
Mm-hmm.
I try to get a feel for the group that I'm speaking to.
Yeah.
Certainly, I need to, be much simpler in my explanations for youth. But I find that they are the most understanding.
Yes.
And if you can, put things into terms that they can relate to, that they are far more understanding than most adults.
I love that kids are so open. I think that maybe just because of their age, there's been some less judgment in their life. They're full of love. So many kids. But there's so many kids that you recognize already probably need some help. And teachers are instrumental in that, because sometimes parents don't know how to deal with that. Do you talk to professionals like that, guidance counselors, because they, especially during this pandemic, we've had, cases where kids have been so isolated, it's to their detriment. And we don't have the teachers reporting this and the guidance counselors, and the parents are struggling with so many different things. It seems like it's insurmountable, but yet we have to get to those kids. How do we do that?
and there are some serious concerns there. I mean, we're seeing, it's some scary numbers about how many children are reporting anxiety and
Right.
depression as they deal with this going on, 14 months now, pandemic.
Right.
A big source of, mental health support for children has always been in the schools, and we've come a long way there. So not having access to those resources has been particularly challenging to our youth.
When people ask you about stigma, and when you speak to these groups, what advice do you give them about whether it's labeling, using it in a conversation where it's not so kind, or just stumbling over, something like we talked about on the radio, where somebody was using it as a joke, not meaning to hurt anybody, but at the same time could do damage. Mm-hmm. How do we change that approach?
I simply point out the issue to people. I am constantly sending emails, writing letters, making phone calls. Anytime I hear somebody inappropriately use a mental health term. Okay? Bipolar, for some reason, seems to be a very, very common punchline. My own sister once made a comment about the weather being bipolar, and I called her on it.
Yeah.
So, I mean, talking about these things, people start to understand more. A lot of times people don't even think about what they're saying.
Right.
But once you point it out, the next time they're going to think about what they're saying.
I bet she was surprised.
She was. And apologetic.
And yeah, and certainly didn't mean, didn't mean it in that way. It was her way of describing it. And I told you a personal story myself about just, I was much, much younger. I was, late teenager and teasing friends and talking about someone being stupid. And I said, don't be retarded. And he said, that's the meanest thing you could say to me. And I said, what do you mean? I just called you stupid. He said, no, you didn't. That's different. And I think that for me helped flip the switch in my head. And I think that if people start thinking about that more and kindness, so many people are talking about kindness now. And I hope this continues to catch on, that we don't have to be bland. We don't have to worry that we're always going to hurt someone's feelings, but there are better words to use.
Absolutely. And learning those better words can actually start the conversation. And those of us, that have mental health challenges feel much better if we're able to talk to people about it. And we don't feel like we're walking on eggshells and hiding some big secret from people.
And I think as we start to turn that corner, I've heard other people be critical and say, well, if we're doing this all the time, we're never going to be able to laugh at ourselves. We're never going to be able to, we're going to be worried about our words to the point where we're not going to say anything because you never know if you're going to hurt somebody's feelings. And I think that's taking it to the extreme.
Yeah, I mean, there's the whole backlash against, the politically correct movement. But I mean, there are terms that we need to think about how we use them and the effect that we're having on people when we do use them.
Politics. No, I don't want to get political, but I want to touch upon the fact that that's coming into play with the money that's finally coming into organizations and states to start furthering that education about mental health awareness. Do you think that this is a good thing for us, that we're starting to get help like this?
Absolutely. I mean, anything that, can be done to get the word out and start to change people's opinions is invaluable.
How do you see the next year going as we come out of the pandemic? What are you telling people about mental health and they're coming out of this with feelings of anxiety, depression, anxiety, wondering if we'll get back to normal and what that normal is, because for some people, especially if they're already dealing with some mental health issues, readapting to everyday life that we knew before a year ago is tough. What do you say to them?
I think we have a lot of challenges coming up in the immediate foreseeable future. I mean, we know that anxiety and depression is up, that people are feeling a lot more anxious about what they've been through over the past year. We now know that there seems to be some connection between people that have had COVID and psychiatric symptoms.
Really?
There seem to even be some neurological issues that are going on. So we know going forward that between people that have had COVID with some psychiatric side effects and the people that are experiencing anxiety and depression because of the pandemic, we're going to have an increased need for mental health services. The problem is that the system is already at its breaking point. So meeting that increased need is going to be our challenge for the next year or so.
So it's better that the government's getting involved with this and at least understanding what states are going through, local levels, local governments, and local organizations. Because
Absolutely.
you can't always fundraise for everything. There's such a need for money for so many organizations. I feel like there's God bless all the people that are fundraising, but there's a point where it's got to have government and social organizations work together. And I think it's nice that it's being recognized is where I'm going with this.
Right.
Obviously, there's more of a need too.
Yeah, I mean, New Hampshire has done a good job recognizing what the issues are. recently came out with the 10-year plan to address mental health issues. And there's some really good ideas in there.
Yes.
And Governor Sununu made the commitment to funding that plan. When there was talk that there might need to be budget cuts because of the pandemic, he basically said that, mental health was off the table.
Mm-hmm.
So the funding has been there from both the state and the federal level.
So that's comforting for you, knowing that's it's being taken seriously.
Very comforting.
What were some of the points that you thought are going to be addressed in that plan that maybe haven't been focused on so far?
Well, there's a big focus on peer support.
Mm-hmm.
And peer support is an evidence-based practice. We've known that for years. But there's been a huge expansion of the use of peer support in New Hampshire and across the country. One of the things that is in the 10-year plan is the use of step-up, step-down programs. And those are peer-operated programs that provide either a step-up to avoid psychiatric hospitalization,
Mm-hmm.
or a step-down from somebody coming out of the hospital and transferring back to the community. Those are entirely peer-run programs, and they're just starting up, but they hold a whole lot of promise. We have peer respite programs in New Hampshire. The same thing. They're intended to be a diversion from psychiatric hospitalization. And from follow-up surveys that we do with people that have used those services, it in fact works that way.
I'm speaking with Thomas Grinley from the Department of Health and Human Services. It's May and Mental Health Awareness Month, and I'm glad that we've been focusing a lot on what we've been dealing with as a state, what we've been dealing with through the pandemic, and your job and trying to break that stigma, as you said so often during this segment. And I think that that's important for people to circle back and remember that part of talking about mental health is breaking the stigma and being able to have those conversations. And you in particular have been an advocate for this. So thank you for that. But also thank you for sharing your own story, because I think that's the first step.
It was for me.
And I think that also for people who are thinking about it, or you want to talk to someone about it, what is the advice that you would give them? Now we have a couple minutes left, and I kind of wanted to recircle back to that, because there are people who still, they don't know what to do. Tell them how they can get help.
First of all, you got to keep in mind 1 in 5 people are experiencing a mental health challenge. Okay, so it is not that unusual. If you're facing challenges yourself, you have to recognize you're not alone and reach out for that help. It's there.
Absolutely there. Are there some special organizations that you would recommend they reach out to, or any websites where they can get information as well?
Well, obviously, you can check out the Department of Health and Human Services website. There is a link there to the peer support agencies throughout New Hampshire. NAMI New Hampshire obviously has some great resources. They are fantastic, working with families in particular. Those are probably the best places to start.
Thomas Grinley, thank you so much for joining me today, talking about breaking the stigma for mental health awareness. I think it's an important message that you are part of a growing army of people that's trying to get out there.
Thank you.